I'm going to take a slightly different tack and talk about the potential for community-based participatory research using a technology-based program. So I'm really going to walk you through some of the struggles or questions that we have as a team using this product. So, and that's pretty much what the goal of my next 15, 20 minutes would be, 15, 18 minutes would be. Okay, and that I think most of you are familiar with. That's the definition. I have highlighted a couple key words because that's really what I'm going to talk about as I go through feeding your kids. When we look at the issue for feeding your kids, which is a parent-based nutrition, email, and text program, we know that the issue is child growth and health. And all children grow. And that food is a critical part of that process. And if we give that child the best opportunity to be fed well, that child most likely will also have the best opportunity to be healthy. And that's important because feeding is not just about food. There are other things that go with it. So knowledge, resources, and we have to look at barriers. This shows you really the prevalence rate of overweight and obesity across the globe. And it will become obvious in the next slide why I picked this rather than just the US prevalence rates. And what you can see is that between 1990 and 2010, it's pretty much been going up across all the different continents. So whether you're looking at Africa, Asia, Latin America, pretty high in Latin America. And if you look at developed and developing countries, while it is much higher in developed countries, it is rising also in developing countries. So if we move back, we talked about feeding your kids as a technology-based program. So let's just have 2 slides on technology. There was a great poster outside that looked at mHealth. We know that you can use technology in forms of mobile technology to make changes in health. So I'm going to just highlight one paper. And this was a paper with adults. It was a randomized controlled trial. The adults were 21 to 60 years old. And they really had a phone and a PDA, and they took pictures of their food. And the whole goal was that they had 4 different messages or 4 different behaviors they wanted them to change. And they wanted to figure out if we use mobile technology, which of those 4 would they be most likely to be successful in? And what they found was that their highest success rates were measured in increase in fruits and vegetables and decrease in sedentary leisure behaviors. However, when they looked at whether they were able to decrease saturated fat or increase physical activity, this program, this PDA mHealth program, did not really help them do that. The other slide that I put in, this is way out in infectious disease, and this is looking at H1N1 between September of 2009 and January of 2010. And this slide demonstrates to you how you can use mHealth technology to have the community speak to you. So what it's showing you, if you look at the blue dotted lines, are really people reporting cases of infectious, what they think are infectious cases of H1N1. And the red line shows you the CDC surveillance map. And what's important is that where you see the peaks in the blue, you're also seeing those peaks with the red, which is the data was collected in a more objective fashion. So it tells us that, yes, we can communicate with our community using these forms of technology. So when we go to the next point that I highlighted in the definition, which is representatives of organizations and researchers, let me talk a little bit about Feeding Your Kids Foundation. This is a foundation that's based in San Francisco. It is a member of the Clinton Global Initiative. And for those of you that are familiar with it, is that companies come up, they're members of this initiative, and they offer something. This foundation has offered to give this email and text program free to anybody who will sign up. So that's their commitment to their CGI. They've partnered, they have different partners, but today I'm going to focus on our hospital, the University of Michigan, and Sweden. So Esther has a different kind of background. She's actually an economist and then did further training at Harvard Business School. But what brought up this program for her was that she was a mother and she had 2 children, and she was trying to figure out how best to feed them. So like I said, it is totally free. It has 2 aspects to it. There's an email portion and there's a text portion. And you can sign up for both of them or you can sign up for one of them. When we met with Esther and her group, we looked at her program and we recognized right off the bat that her program was meant for San Francisco, California. And I say that because when you looked at the foods in her program, they did not seem to fit the population that we would see in our clinic typically. So we decided we needed to customize their program, and they were willing to do that. So on the left side of the slide is our flyer on our customized program, and that was in partnership with the University of Michigan team. When we customized ours, FYK is a 42-day program. We customized ours to either a 45 or a 90-day program. FYK offers 2 emails a day. We cut our own down to 1 email a day. And this was based on a lot of feedback from staff, from healthcare providers, and from our parents. And if you did a 90-day, you would get emails every other day, and you would get text every other day. So it kind of spaced out the program. It is really broken down into blocks, and at the end of the program, you can download a PDF of the whole program. So these are like key blocks, and the blocks are not done from a nutrition education perspective. It's really, as a mother, what are the questions I'm asking when I feed my 7-year-old child? So we do things like, what are the decisions you should leave for your child? It's important in that feeding relationship. This is an example, and probably not the best, of one of the emails. This is the typical feeding your kids email. The top is the morning email, and the second is the afternoon email, and right at the bottom is the text. In our program, you get only 1 email, and then there's a text. The text and the email are linked together, so the text is served as an action-oriented email to remind you of what is in the earlier email you received. I should have shown pictures. We have pictures embedded in the program. We have videos embedded in our own program, and the actual program has now taken that and embedded it in the main program that they have. They are working on a technology that allows the patient to answer a question and see the response immediately so that they know how well they're doing. So this really comes back to the community of FYK. Because it is technology-based, it's email and in its text, one of the things that happened is that they found out that they had a global community. So if you look at every place that is highlighted in green, those are areas where FYK has been used. There are about 85 countries in the last 2 years. When I look at FYK in the development process, we've had a phase 1, a phase 2, a phase 3, and really a phase 4, which is what we're hoping to make it a little bit more community-based. These are the key areas of our phase 1 and our phase 2 and our phase 3. We're right now really completing more of the phase 3. Like I said earlier on, we've had parent feedback, we've had it through the schools, we have healthcare providers, we've had staff, we've had dietitians review it as we customized our program. So we really went back to phase 2. We had them go through the program, we got feedback, and right now we're doing the small-scale pilot study. And I'll show you a couple of the results from both the Feeding Your Kids program in San Francisco, as well as our customized program for Nationwide Children's and the University of Michigan. So this is one of the questions that they answer, and this is coming from this is in the period of 1 month. This is the response in 1 month. There was 392 responses, 162 cities from 50 countries. And you can see that if you look at agree somewhat, just being aware of how your child eats is usually the initial step in feeding your child better. They also indicated that they had improved their knowledge about good nutrition. and that their kids, more importantly, at least about 80% plus their kids were willing to try new foods or new habits. Okay. Now, when we go back and we look at the smaller, the customized program, one of the things we did in our customized program, since it was still a pilot, was that we embedded in surveys. So at 20 days into the program, there was a survey they needed to do, and at the end, there was a survey they needed to do, which was longer, and allowed us to assess self-efficacy with the program. So if we looked at the earlier response, the question was on a scale of 1 to 10, with 10 being very confident. How confident are you that you know how to help your child eat healthier foods? And we had 63.7%, 27.3% indicate 9 to 10 on the scale 20 days in. When we looked by the end of that program, that had at least doubled plus to 64.3%. And I think more interestingly is that we did not see anybody lower than 5 in the post survey. However, we went back and we said to them, well, tell us your perceived usefulness of the text and email message. Remember, this is an email or a text, and you can decline the text or you can decline the email. When people decline the email, we usually advise them that the text does not stand alone. So most people will sign up for the email. It's totally free, and if you have a payment plan that charges you for text, you can decline that. And it's interesting, this is our own population. It's made up of parents from our school, from events we go to. We take the little flyers, we have people sign up, we sign them up, and we see that they're really indicating that the texts were less helpful than the email. Now, it may be the way the texts were written, because they were so short and it really wasn't giving information. It was more reminding you of the email. But the other thing we know is that the mean age of the people who completed this survey is somewhere in their 30s. So they may have a preference for email than they do for text messages. We also had about 40% of them were Caucasian, about 35% African American, and actually about 23% were Asian. Okay. So in pulling that together, when we look at that data, we come back to how can we make this more community-based? Who is the community of FYK users? It is difficult to figure out who our leaders are in different communities. We've got to figure out how do we define them. Is it going to be a geographic community? There is global spread, which is exciting. It's nice to have 85 countries. People from 85 countries doing the same work. And actually, the feedback from a lot of the users in different countries is just fabulous. It's amazing to read their feedback because you can free text to us. Is there a way in which you can create a web-based framework on how to adopt this program for each community? Because every community is different. The food they eat is different. The culture around feeding is different. And here in Ohio, one of the things we've looked at is using our healthcare centers, our clinics, as our own community as an initial start. So we're looking at that. The University of Michigan is doing the same thing. We have a group called Ohio Healthy Weight Outcome, which is really an organization of different community organizations and healthcare providers and the public health sector. Is that perhaps a starting point for FYK? And that's really one of the places that we've presented it as we've gone through the phases. We also have a focus group that's planned with the people who've completed it so we can get a sense of if I move this into my community, this is what my community looks like, or this is how I see us doing that. So I am going to, in this slide, this is what we see the phase 4 process look like, but I'm going to just stay on the Scandinavian country example because we've moved a little further with that, and that is in Sweden. So what we've done is in, gosh, I'm gonna probably kill the name of the city, but we've partnered with a school district in Sweden, And this is being led by a mother. So they have, Sweden has really a tight-knit setup, and there's a mother who has a child who's overweight, who is really concerned, and she's leading this effort with us. So in this partnership, the local doctors in that area will come in and they'll do a couple presentations about healthy eating, nutrition, and this is all going to be set up by their organization or the association of mothers within that school district. And then the program is going to be offered to every child within the school district. We're right now in translating the program into Swedish and also looking at some of the language to make it a little bit more familiar to that culture. But this would be really the first step in moving it into more of a community-based participatory research project. They have a group of researchers. We are hoping that we would learn from them and be able to partner with them in a way that we will be able to bring back some of the surveys and the instruments that they're using to test what's happening in Sweden, closer home in Columbus. So in summary, we know that when we look at the Feeding Your Kids program, which is a free email and text program, it is meant for parents, that it can change behavior. The exponential use of technology across really not just the US, but every country. I think anybody who is originally from outside the United States, the one thing that just strikes you when you go back home is how every single person has a phone in every country, or every single person has a BlackBerry. It's just amazing to see how that growth has gone. So it really increases the potential of both email or texting as a way to drive health. And I think that although there are challenges that exist through this process, and we're open to listening to people who've done this on larger scales, to getting your feedback, it is a unique opportunity to establish really some sort of a CBPR program on a global scale. Thank you.